Hi, my name is Eleftheriadou and I'm a concerned dermatologist at Walsall Healthcare and the Royal Wolverhampton NHS Trusts. I am also an honorary associate professor at the Institute of Applied Health Research at the University of Birmingham. I'm the lead author of the recently accepted study entitled Burden of Disease and Treatment Patterns in Patients with Vitiligo. Vitiligo is a chronic autoimmune skin disorder which can have a profound negative impact on patients' quality of life and psychological well-being. The prevalence of vitiligo comorbidities in the UK has not been investigated. The objectives of the study were to determine the annual prevalence and incidence of vitiligo each year between 2010 and 2021. And also to describe treatment patterns, including time from diagnosis to treatment, utilization of healthcare resources from 2010 to 2019. This was a retrospective study utilizing clinical practice research data link CPRD data and hospital episode statistics database. Cohort included in the study were adults and children of 12 years or older with a diagnosis of vitiligo. The mean incidence of vitiligo was 0.16 per 1,000 person years, and the prevalence increased from 0.21% in 2010 to 0.38 in 2021. The most common comorbidities after vitiligo diagnosis included thyroid disorder, diabetes, eczema, and rheumatoid arthritis. Mental health diagnoses were most commonly depression and anxiety, affecting almost 1 in 4 patients with vitiligo. Just over 60% of patients with vitiligo had no record of vitiligo-related treatment in the first year of diagnosis, and this number increased to 82% in the second year. Median time from the diagnosis of vitiligo to first vitiligo-related treatment were 34 months, and the most commonly used treatments included topical corticosteroids and topical calcineurin inhibitors. Interestingly, almost 17% of patients were prescribed antidepressants or anxiolytics in the year after the diagnosis of vitiligo. Our study showed that there is a delay in medical treatment initiation, which suggests that patients with vitiligo receive suboptimal care compared with that outlined in the recent PAD guidelines. Most patients were not on vitiligo-related treatment within a year of diagnosis, suggesting that vitiligo may be dismissed as unimportant. Our study highlighted that there was an approximate delay of 3 years between the diagnosis and first vitiligo-related treatment, but in the meantime, almost 17% of patients received anxiolytics or antidepressants. Our study highlights that new effective treatments and early treatment initiation in combination with psychological interventions are needed to reduce the disease burden in UK patients with vitiligo.